So first of all, you have to classify what is pain with intercourse, because technically you can have pain right at the entrance, which like the vulvar, the introitus, which would be like more superficial pain, and then you have like the deep pain, which are more like at the end of the vagina, close to the cervix or the vaginal vault, which is deep, the deep pain. And yeah, so many reasons. So definitely if you have pain with intercourse, you would need a gynecologist, like a doctor, to take a look just to see. It can be pain because you have a skin issue, so it could be just vaginal atrophy, meaning just menopausal tissues are so thin. You could have lichen sclerosis, which is a skin condition of the vulvar area, lichen planus, again, skin condition of the vulvar area or vagina area, which you have, like, you can see when you do an exam. It can be like if you have more deep pain, then endometriosis is a very common reason to have like painful intercourse. We just talked about lubrication, so just lack there of lubrication can cause pain. It can be like muscular or ligaments. The vagina is a muscle, so you can have like muscle spasm there, knots that you can see, like trigger points that can cause the pain. Just a retroverted uterus, which is a normal variant. So the uterus can be either anteverted toward the front, toward the bladder, or toward the rectum, like the posterior part. And then just having that posterior retroverted uterus can cause pain because we're like going in deep and then always touching the tip of the uterus.
So we're going to be asking if the pain is in every position or if it's just in certain positions. Because of those reasons.
Is it just with the insertion, or is it deep with penetration? Does it come after the intercourse, during, before? Is it held with lubricants?
Is it every single time or just once in a while?
Because it can be just cycle related, just based on the ovulation that can have pain. Every time you have your period or ovulate, you have a little blood sometimes inside the belly that can irritate and be more painful.
Has it always been like that, or is just since the birth of your baby, or it's just since menopause, or it's just since your new partner?
And do you have an infection? An infection can just be like, an STI, so sexually transmitted infection.
Bladder infection?
Bladder infection, yeah.
Yeast infection?
Yeast infection, yeah. Painful bladder syndrome, so that's pain on the anterior vaginal wall, so that you have pain and symptoms with the bladder, but every time you have intercourse, you can have pain with that.
So, with all this being said, what's the conclusion? If you have painful intercourse, you need to see. You can see
your family physician or a physician, so that they can do a pelvic exam, a gynecologic exam.
Agreed.